So when we look at those essential health benefits, whether it's mental health care or potentially for other health conditions, that is no longer essentially covered or required to be covered by this version of this text. Is that not correct?
The text before us does remove the application of the essential health benefits for the alternative benefit plans in Medicaid.
Sorry, it does what? I apologize, I just didn't get. I'm sorry, sir, I genuinely didn't hear what you, it does what?
It does remove the application of the essential health benefits on the alternative benefit plans.
It does remove them.
Correct.
Yes. Including mental health. Yes, thank you.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it. Get rid of the fraud, get rid of the waste and abuse, but save it. People have been paying in for years, and now many of these candidates want to cut it.
We're talking about hundreds of billions a year throughout the country. This is so much bigger by orders of magnitude than welfare reform, because let me just describe exactly what this bill does for conservatives. This is why I'm so excited about it, and this is why I think people need to see the forest through the trees. We are defederalizing an entitlement, block granting it back to the states, and capping its growth rate. That's never been done before.
And when Hewitt asked Ryan about the possibility of the Congressional Budget Office coming out with a number that 15 million people will lose insurance under the GOP health care bill, Speaker Ryan responded with this.
You're never going to win a coverage beauty contest when it's free market versus government mandates. Our goal is not to show a pretty piece of paper that says we're mandating great things for Americans.
Joining me now, Congressman Joe Kennedy III of Massachusetts, member of the House Energy and Commerce Committee. You're shaking your head. What do you think about that line from Paul Ryan?
Look, it's just not who we are as a nation. It's not what healthcare is all about. Healthcare, at its most basic, healthcare is about taking care of those among us in their time of need. That is what healthcare is. That is what healthcare does. And why I think so many of us are so upset is we've got essentially what is really a massive tax cut to the wealthy on the backs of hardworking families that are working paycheck to paycheck and costing 15 million people their health care, all in the name of health care reform. It's outrageous, and it's not who we are as a country.
I want to focus on that exchange you had, because I think one of the things that folks have underappreciated is what Paul Ryan boasted about. This is a huge cut to Medicaid over time, and one of the things it does is that it delays them and then it caps them, so over time they get more and more severe. So in the early years, people don't recognize, but the folks that need it most, say mental health, addiction treatment, folks in West Virginia where 30% of the folks are on Medicaid, like, they are going to take it on the nose.
Yeah, absolutely, absolutely. And look, we try to expose this a bit in our hearing over the course of those 27, nearly 30 hours that we were in that room together. And it was abundantly clear that, one, most of my Republican colleagues didn't understand what the bill did, and two, that for those that are in need, for families that are working paycheck to paycheck, who have operated under the idea, the value that we have as a country, that in your time of need, we will care for each other, that they're going to take it on the chin. And what this does, if you look at the technicalities of it, is it erases, it rescinds these essential benefits for folks on Medicaid, preserving them for everybody else, and tries to pass off a huge tax cut literally on their backs. And so for folks that are looking for maternal care, for folks that are looking for mental health care and opioid addiction care and ambulatory care and basic wellness and prevention services, all of those are now at risk. And our colleagues try to say, well, there's additional funding that is set aside that might be able to cover it. One, the funding isn't anywhere close to covering it. And two, the whole point behind the Affordable Care Act was making sure that everyone across the country got the care that they needed when they needed it. And again, this bill blows a hole in that very value that we have as a country. And that's why I think it's so insulting to those of us that are trying to expand on those efforts and make sure we strengthen the Affordable Care Act and build upon the values that we've built. But what Speaker Ryan has said, and you know, amazing that he's willing to go out there and say it, because we certainly didn't hear that rhetoric last night, right, during the course of that, or 2 nights ago, during the course of nearly 30 hours together in the room.
Congressman Joe Kennedy, I appreciate your time tonight. Thank you very much.
Thank you.